So we're going to go over anginas. We're going to go over grafts, coronary artery disease, myocardial infarctions, and heart failure. So we're going to split this into 4, and I'm just going to start right now saying that coronary artery disease is occurring when there's atherosclerosis in the plaque, and that occurs because you have the damage of the epithelial tissue of the blood vessels, and the epithelial tissue is going to accumulate fat within the smooth muscle area. And so the accumulation of fat is going to create this bulge, and that bulge is going to be filled with collagen. And that collagen, once it erupts, is going to cause thrombosis, and that thrombosis is it's platelets that are forming, and that platelet is going to be dislodged into the heart's coronary artery, and that'll cause a heart attack or a myocardial infarction. Or if there's enough plaque or platelets that are growing in the coronary arteries, then you're going to have ischemia, or you're going to have angina, which means chest pain. So there's a lot of risk factors associated with angina. You have obesity, metabolic syndrome, high blood pressure. You have obesity. You have high lipid profile. And so obesity is defined with a BMI of over 30, and you're going to have an increased level of you have an increased lipid profile, which means that you're going to have over less than 40 HDLs, milligrams per liter, I think. So the value is 40, and then you're gonna have 100. You're gonna have greater than 130 LDLs, and overall you're gonna have over 200 for the cholesterol. And BMI is gonna be over 30. You're overweight, and the age is a non-modifiable risk factor, and so people with age, genetic dispositions, gender, and also race, you're going to have a different risk factor for it. So men at the ages of 45 are at highest risk, and women at the age of 55 are at the highest risk. And so once you have these risk factors, there's all these medications that help you control the coronary artery disease. The first one would be niacin. And niacin, what it does is increases HDL and lowers LDL levels. And then you have fibric acid derivatives, which increase HDL levels. And then you also have HDL, niacin. Then you have something called I believe it's a PCSK inhibitor, more cholesterol to be disposed. And you'll also have something called bile acids or bile sequester. And that, what it does is it converts cholesterol into bile, so it reduces your cholesterol levels. And then you have bile acid sequesters. And then you have, after bile, you have cholesterol excretion through the feces. There's a drug that increases defecation, and that process leads to a decreased level of cholesterol. So the causes of angina are smoking, use of illicit drugs, the exposure to a high temperature like the heat, physical exertion, and and so the causes of angina are physical exertion, temperature, exposure to high heat. So physical exertion, temperature, high heat, tobacco use. You have illicit drug use. You also have emotional stress. You also have the consumption of a heavy meal, sexual activities, and also circadian rhythm. So in the morning, it'll just happen. So those are the causes of angina. And there are 4 different types of anginas. The first one is stable angina, and that's triggered by physical exertion. and it has a ST depression. And then you have Prinzmetal's angina, and that is going to be caused by rest. It's just going to happen while you're resting, and it's going to have an elevated ST. It's going to have an ST elevation, ST segment elevation, and silent ischemia happens, and it causes a ST segment depression, but there's no symptoms. You're not going to feel the pain. Only through ECG will you know. And you also have, when you have ischemia, you should have acute treatment, which is involving biomarkers, EC12 ECG monitoring, and then you have the biomarkers, the vital signs, the heart sounds, the lung sounds, sitting the patient upright. Those are the 5 or 4 actions that you should have when you are trying to treat for angina. So the next sections, we're going to go over grafts. We're going to go over grafts. We're going to go over myocardial infarctions, and then we're going to go over heart failure. So stay tuned.